Department of Justice only investigates giant healthcare corporations? Well, think again. The DOJ recently announced the largest healthcare fraud takedown in U.S. history, more than $6.5 billion in alleged fraudulent claims. While this case focused on large fraud schemes, there's an important lesson for every small medical and dental practice. Hi, I'm Kelli with Healthcare Compliance Associates, and in the next few minutes, I'll explain what this means for your practice, why regulators are using AI to identify billing concerns faster than ever, and 4 practical steps you can take today to strengthen your compliance program. First, don't panic. Most small practices are doing their best to provide quality patient care and bill accurately. The biggest takeaway isn't the dollar amount. It's how investigators are finding potential fraud. Government agencies now have access to sophisticated technology that can analyze enormous amounts of billing data much faster than ever before. That means documentation and compliance have become even more important. First, let's talk about what's really changing. Years ago, investigations often started because of complaints or random audits. Today, regulators can compare billing data across thousands of providers using advanced analytics. They're looking for patterns such as unusual coding, excessive utilization, duplicate claims, services that don't match documentation, or billing that's significantly different from similar providers. Now, that doesn't mean every unusual pattern is fraud, but it can mean your practice receives additional scrutiny. And if that happens, your documentation needs to clearly support every service you bill. Technology may identify an unusual billing trend, but your patient records explain why that care was appropriate. Every chart should clearly support medical or dental necessity, services actually performed, accurate coding, complete clinical notes, and appropriate signatures and dates. Let's look at an example. If an auditor can't connect your documentation to the services billed, your practice could face unnecessary questions, even if the issue was simply incomplete documentation. Now, the good news, strong documentation is still one of the best ways to demonstrate compliance. Another important lesson from the recent DOJ guidance is how organizations respond when concerns are raised. If an employee reports a coding concern, a documentation issue, the possibility of a HIPAA violation, a billing error, or another compliance concern, don't ignore it. Instead, document the concern, investigate it promptly, preserve relevant records, document any corrective actions, and consult legal counsel if significant legal issues are identified. A prompt response not only helps solve problems early, it also demonstrates that your organization takes compliance seriously. This is where many small practices struggle. Compliance isn't just annual OSHA training or updating HIPAA policies. Strong compliance becomes part of everyday operations. That means regularly reviewing documentation, performing internal billing audits, educating staff, updating policies, and following up on identified issues. Many practices use spreadsheets to manage these activities, and that's perfectly fine. The important question isn't what software you use, it's whether you can quickly demonstrate that compliance activities are actually happening. If you're wondering where to start, here are 4 simple things you can do this month. Number 1, review a sample of recent patient charts. Make sure documentation supports every billed service. Number 2, make sure employees know how to report compliance concerns. People should feel comfortable speaking up. Number 3, review any unresolved compliance issues and then document what was done to resolve them. Number 4, schedule routine internal audits. Don't wait until an outside auditor finds the problem first. Small improvements made consistently are far more effective than scrambling after the audit. So what's the bottom line? The DOJ's healthcare fraud takedown isn't a reason for honest healthcare providers to panic. It's just a reminder that healthcare compliance is becoming increasingly data-driven. Fortunately, the fundamentals haven't changed. You want to focus on strong documentation, regular internal reviews, ongoing staff education, prompt investigation of concerns, and continuous improvement. Those are the habits that help protect both your patients and your practice. If you're not sure whether your compliance program would stand up to today's enforcement environment, we'd be happy to help. At Healthcare Compliance Associates, we work with healthcare and dental practices throughout Oregon to build practical compliance systems that are easy to maintain and designed for the real world. If you'd like a no-obligation compliance risk review, you'll find the link in the description below. And if you found this video helpful, subscribe for more Oregon healthcare compliance tips every week. Thanks for watching, and I'll see you on the next video.